In patients with suspected trauma, it's a very similar technique. The key, however, is that you are going to be very careful not to tip the head back. So you're going to use the jaw thrust technique to help open the airway, as opposed to the head tilt chin lift. So the big difference is here. Do not tilt the head or the neck. The rest of this you can read through, but it's really the same thing. So here's the thing. Sometimes when you're trying to use the BVM, the chest isn't going to rise. And at that point, you need to reevaluate. This is troubleshooting. So if the abdomen rises, reposition the head or the jaw, because that means that you're putting air into the esophagus, into the stomach, and we need to adjust the airway so that the airway itself is open and it's not going into the stomach. It may be that you have air escaping under the mask, so reposition the fingers in the mask and check for leaks. You also want to check for obstruction, and I think this is a big one. Make sure that the airway is patent. Is the airway patent? If the chest still does not rise and fall, then you're going to need to try a different method of ventilation. I'm going to put in here, you can ask for help. Make sure you have 2 rescuers. And have one really focus on managing the airway itself and have the other focus on squeezing the bag. At this point, you also need to consider calling ALS. If you're using a BVM in general, ALS is probably a good idea. Not always, but generally speaking, if you have ALS available, get them en route. ALS can do some other treatments for conditions that can affect breathing. So this here is a flow-restricted, oxygen-powered ventilation device, or a manually triggered ventilator. And basically what this is a regulator that attaches to your oxygen bottle. So there's your bottle, O2, and it flows in and it flows through this tube, and this end attaches to a mask. So this would be the end that attaches to the mask. That's not a very good mask, but it's a mask, I assure you. So it attaches to the mask, and this is the end that goes to the patient. This little trigger here is basically a trigger to force oxygen in. So as you hold it down, the patient's basically going to get a breath. And as you let it go, its patient's going to be allowed to breathe out. So with this flow-restricted oxygen-powered ventilation device, FROPVD for short, you get a peak flow of 100% oxygen at a maximum of 40 liters per minute. So these are just some settings, but basically it's possible to give your patient 100% oxygen if you have the settings right. There is a pressure relief valve that opens at a pressure of 60 centimeters of water. So this is another measure of pressure. And there's an audible alarm that sounds when the relief valve pressure is exceeded. The trigger is set such that both hands can remain on the mask to maintain the seal. So this would be instead of a BVM. So this would be a better option than a one-person BVM, because you have the ability to keep a better seal with the mask. One of the big contraindications for this is using it on children or infants. Don't ever use this on children or infants, because they have much smaller lungs, much smaller chests, and they can't withstand the pressures delivered by this device. So never, ever on infants and children. So how do we use the manually triggered ventilator, or the FROPVD? Ugh, such a long name. Okay, so flow restricted oxygen powered ventilator device. So first thing we're going to do, open the airway and then put in either an oral or nasal airway adjunct so that we can maintain it. So open, clear, maintain. And I know clear is not in there, but we do want to clear it. So suction if we need to, maintain the airway. And we're going to take the mask, and you can see the mask here. So this is the apex of the mask. That's going to go over the bridge of the nose. The other rounder part is going to go by the chin. So put your thumbs over the top half of the mask and the index and middle fingers over the bottom half, and the others are going to go around the chin of the patient that this is sitting on. So just like with all the other masks type of ventilation, bring the jaw up into the mask, and you're going to trigger the device until the chest rises. And then you're going to let it go, and then you're going to repeat this every 5 to 6 seconds. In a patient with suspected trauma, it's very similar, but you want to have the patient, have somebody hold manual C-spine, so that you don't end up rocking their head back. And then you don't do the head tilt chin lift technique, but you do the jaw thrust. You bring that jaw up into the mask, and that's going to help in conjunction with the OPA or NPA. It's going to help keep that airway open, and the rest is the same. Trigger the device until the chest rises and repeat every 5 to 6 seconds. Remember, we don't have the kids' respiratory rate listed here because this is not for use in kids. So don't use on kids.